Nonverbal learning disorder has been defined as a childhood disorder with basic neuropsychological deficits in visuospatial processing and psychomotor coordination, and secondary impairments in academic and social emotional functioning.
These deficits cause difficulties in many aspects of the child's life. According to Stephanie Morris, children experiencing learning and behavioral disabilities are unable to establish and maintain friendships as effortlessly as their peers without disabilities. Unlike children with disorders such as autism or Asperger's syndrome, children with nonverbal learning disabilities desire and enjoy social interactions. Although a natural and essential part of the human existence, friendships involve a series of complicated social interactions, often using many or most of the social skills and competencies these children lack, including social perception, interpersonal communication involving nonverbal language, and self regulatory behaviors. It may be difficult to understand why something that comes natural for so many of us can be intimidating. How can a child want to be social yet lack the skills for executing it? To answer that, we must break down some of the terms associated with nonverbal learning disorder. First, the word nonverbal refers to the disability as it deals with social cues, patterns, and concepts that do not deal with verbal language. Nonverbal means to have trouble understanding information, recognizing relationships, concepts, ideas, patterns, and applying them to new situations. The next terms are defining the concepts that those with this disability struggle with, such as visual and spatial awareness. Visuospatial is relating to or denoting the visual perception of the spatial relationships of objects. Many kids with nonverbal learning disorder have trouble understanding visual imagery and evaluating visual spatial information. This means that they have trouble grasping the relationship between things they see and having a clear sense of where they are. The next struggle is high order comprehension, which is the ability to identify the main idea in something, the details that support the main idea, and the relationship among them. This affects kids' ability to comprehend reading and write or tell a story effectively. It also affects taking notes. Basilko observed that some kids essentially take down everything or nothing at all as a teacher talks because they don't know what's important and what to not take down. Although most of these words seem to relate solely to social skills at first glance, we must look at how they play a role in educational settings and their effects on progress in school. The research from Stephanie Morris states that these students have trouble initiating various interpersonal behaviors, including introducing themselves to join in conversation, work, or play. They may have little regard for typical school behavior related expectations, such as listening, following directions, and waiting to take a turn. This can exhibit itself as a lack of willingness or ambition in regards to schoolwork. There are a number of therapies and educational strategies that can help your child manage and work around nonverbal learning disorder symptoms. These include social skills groups to teach kids how to handle social situations such as greeting a friend, joining a conversation, and recognizing and responding to teasing. Parental behavior training that could be ran by a psychologist to help parents learn how to collaborate with teachers, and also teach parents how to help kids with social skills in playdates and extracurricular activities. Another one is occupational therapy to build tolerance for outside experiences, improve coordination, and enhance fine motor skills. The child's school will have to determine what services might be available. Nonverbal learning disorder is not one of the disabilities covered by IDEA. This means having it does not make them eligible for special education services. However, if you and the school think that your child needs special education services, the school may test them and identify them as having the most similar disability covered by IDEA. This would allow him to have an individualized education program. Another option may be for the child to receive services under Section 504, which is less restrictive in the types of disabilities it covers. If your child doesn't qualify for either an IEP or a 504 plan, the school may be willing to give them informal accommodations. Creating plans within IEPs under different disabilities could be effective for some students with this disability, but it does not solve the major challenges that students with this disability face on a regular basis. Social skills deficits are an important target for intervention because they have a significant impact on academic, adaptive, and psychological functioning. Group social skills interventions are often recommended for children with high functioning ASD or nonverbal learning disorders, as their name indicates they aim to improve social skills, suggesting that well designed programs aim to improve both social performance and social knowledge. Their use has increased substantially in the last 15 years. A student should be provided with a well rounded education. For some, especially those with this disorder, this means lessons and practice with social and visuospatial interactions. The largest step of progression in integrating these students successfully is to educate everyone on the disability features. The more that we openly discuss and learn about how disabilities affect people, the more we can let go of the stigma. This will lead to more social acceptance and correct accommodations within the classroom.